Good morning, Hampton University faculty. Welcome back to your home by the sea. I am Barbara Lasure-Inman, Vice President for Administrative Services and Chair of the Infectious Disease and Prevention Working Group. The Infectious Disease and Prevention Working Group, appointed by President Harvey, has been working diligently since March 2020 to assess, evaluate, plan, and recommend policies and procedures to reduce the impact of the coronavirus at Hampton University and develop a plan for a successful reopening. We cannot emphasize enough that everyone is personally responsible for protecting the campus community and adhering to the guidelines. The working group with assistance developed COVID-19 guidelines. The purpose of the Hampton University COVID-19 guidelines is to maintain a healthy and safe campus environment and to minimize the spread of COVID-19 on campus and in the community. Today's presentation, Campus Health and Safety Protocols, will be delivered in 3 parts. First, Megan Hill, Certified Health Education Specialist, will summarize how the coronavirus is spread, the symptoms and warning signs, some of the university's mitigation strategies, faculty protocols, and facial coverings. Following Ms. Hill's presentation is Dr. Marcella Campbell, nurse practitioner in the Student Health Center. She will briefly outline the school dean's responsibilities, the steps faculty must follow to request workplace accommodations, what one should do if exposed, what one should do if positive, and the steps to complete to return to work. Finally, Dr. Christy Norwood, Director of the Student Counseling Center, will provide you with guidance relative to mental health, how to refer a student, and resources for you and students. The highest priority for Hampton University is the health and safety of its students, faculty, staff, and visitors. All members of the Hampton University community have an important role to play in keeping the campus safe by doing their part to stop the spread of COVID-19. In order to minimize the risk of the spread of COVID-19, each member of the Hampton University community must take additional steps to remain healthy and to protect themselves as well as other members of the Hampton University community.
Good morning. My name is Megan Hill, and I'm the Certified Health Education Specialist for the university through the Health Center. Today, I will be discussing background information regarding COVID-19, mitigation strategies that have been implemented throughout campus, as well as faculty protocols. COVID-19 is an infectious respiratory disease caused by a new strand of coronavirus. The virus that causes COVID-19 is primarily spread from person to person through the respiratory droplets from an infected person. Droplets can be produced from coughing, sneezing, or talking. Spread is more likely when close contact within 6 feet of an infected person for 15 minutes or more occurs. The virus may also be spread by people who are asymptomatic or do not have any symptoms at all. Symptoms may range from mild to severe and can appear anywhere from 2 to 14 days after exposure, which is why it is important to know the signs. Signs and symptoms may vary and include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Remember, people who are asymptomatic can still have and transmit the virus even if they do not exhibit any symptoms. Seek emergency medical care immediately if you or someone you know has trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, or bluish lips or face. Prevention is key. Several mitigation strategies have been implemented to decrease the spread of the virus. Housekeeping and physical plant are responsible for daily deep cleaning and campus-wide sanitation measures such as routine cleaning of all buildings, facilities, and transportation vehicles. Twice a day routine cleaning for high-touch surfaces, cleaning and disinfecting of all public or common restrooms, electrostatic cleaning of large common areas after hours, and ultraviolet light disinfection. Plexiglass has been installed for barriers of protection. Directional signs and visual cues have been strategically placed throughout campus for guidance. Temperature scanners will be located throughout campus as well. We encourage you to wipe down your personal workspaces, such as desks, surfaces, telephones, computers, and keyboards regularly, along with high-usage items such as microwaves and refrigerators in break rooms. Protect yourself and others by following faculty protocols. We ask that you please be sure to carry your HUID with you at all times while on campus. Self-monitor your temperature and symptoms daily. If you have any symptoms not associated with another health condition, please stay home. Wash your hands often using soap and water for at least 20 seconds or an alcohol-based hand sanitizer when soap and water are not available. Cover your cough or sneeze with your elbow or a tissue. Avoid touching your eyes, nose, and mouth. Hand sanitizing stations are located throughout campus. Increase the spacing between yourself and others by maintaining a distance of at least 6 feet apart in both indoor and outdoor settings. Configure your seating and furniture for adequate spacing as needed. Virtual meetings and events are encouraged when possible. Facial coverings are required on campus, outdoors, and in all public spaces such as offices, classrooms, common areas, hallways, dining facilities, and in-person meetings and events. Please make sure that your facial coverings cover your mouth and your nose. Breathable, washable face coverings are recommended. Please save the surgical and N95 masks for intended healthcare workers due to the national shortage of personal protective equipment. Thank you for your time, and now I will turn it over to Dr. Campbell.
Good morning. I'm Dr. Campbell, the Assistant Director and Family Nurse Practitioner of the Health Center. I would like to discuss today absenteeism, accommodations, exposure to COVID-19, if you test positive for COVID-19, the return to work policy, and resources that are available to you. If you need to be absent from work due to illness or COVID-19, the deans will monitor your attendance and will report 3 consecutive absences to the Office of the Chancellor and Provost. If you feel that you need accommodations, please notify the Offices of Disability Services as well as the Chancellor and Provost. You will need to provide documentation that includes a diagnosis, how a major life activity you may be experiencing has affected you, and any limitations or recommendations for your particular academic setting. The documentation needs to be provided by a licensed medical professional, and it will be evaluated by the Director of Disability, and they will communicate back to you. If you have been exposed to a person with suspected COVID-19, stay home and self-quarantine. Quarantine separates and restricts the movement of people who were exposed to a contagious disease. It is important that you notify the health center as well as the office of the chancellor and provost. Notify your healthcare provider for medical care and evaluation. It is important that you monitor your temperature daily as well as the signs and symptoms of COVID-19. Notify your supervisor to see if you can work from home. If you test positive for COVID-19, you want to stay home and self-isolate. Isolation separates sick people with a contagious disease from people who are not sick. Again, you do want to notify the office of the chancellor and provost as well as the health center. Call your healthcare provider to seek medical care and evaluation. Take your temperature once in the morning and once in the evening and continue to monitor for symptoms of COVID-19. Notify your supervisor to see if it is feasible if you can work from home. The university has developed a protocol for contact tracing. The health center medical staff have completed contact tracers training via Coursera.org course hosted by the Bloomberg School of Public Health of Johns Hopkins University. Hampton University has identified contact tracers that will be housed in the health center. We will also assist the Peninsula Health Department with contact tracing. The university maintains compliance with Centers for Disease Control as well as the Virginia Department of Health contact tracing guidelines. I would like to go over the return to work policy. You will need to be fever-free and not be experiencing any respiratory symptoms. In order to return to work, you need to submit 2 consecutive negative COVID-19 test results at least 24 hours apart. You may need to request a hard copy of your test results if these are not provided to you. Please mark your name and your HUID number on the 2 negative test results and email to the health center. It is important that you notify your healthcare provider and obtain medical documentation indicating that you have been cleared to return to work, and you want to submit this documentation to the office of the chancellor and provost. The health center is here to provide support for you. We can answer your questions and concerns about COVID-19. We can provide resources for COVID-19 testing and offer health and wellness resources. Thank you and have a great semester.
Hello, Hampton University faculty. My name is Dr. Christy Norwood, and I am a licensed clinical psychologist and the director of the Student Counseling Center here at Hampton University. These are uncertain times. You may find yourself experiencing the impact of COVID-19 or social unrest, or maybe just wondering what the fall semester will truly look like as we return to remote learning. It is very important in the midst of COVID-19 that we all find healthy ways to take care of ourselves. Finding time to take care of your body, getting adequate rest, incorporating proper diet, making time to unwind, spending quality time with those you love and care about, and connecting with those individuals on a consistent basis. In addition, as faculty, you are an integral piece of the puzzle in terms of helping all of us assist our students in maintaining the utmost mental wellness. Here are 3 strategies to do so: awareness, intervention, and resources. First, you'll see here some academic indicators of distress. You may notice that your students have repeated absences from class. Maybe their written assignments have shifted to becoming more morbid, or more confused. It's really important that we recognize some of these academic indicators so we can get our students the help that they need and deserve. In addition, you may notice some changes in their behaviors. Maybe they are more irritable or anxious. Maybe they're fidgeting more as they're engaging in remote learning. Maybe you notice them becoming more hostile or having outbursts in class. These can be some behavioral indicators of distress that our students may be experiencing. And finally, I encourage you to be aware of the physical indicators. Maybe there's been a deterioration in their physical appearance or their personal hygiene. Maybe they're no longer making eye contact with you as they used to in class. Pay attention to these physical indicators because they as well can indicate some possible mental health challenges. So again, as a reminder, awareness is key. The second piece is intervention. Now, I'm not asking you to be an actual therapist, but I am encouraging you to incorporate therapeutic intervention. This includes active listening skills and also being aware of what are our students saying and sometimes what are they not saying. The third component to this piece of the puzzle is referrals. The Student Counseling Center remains available to provide therapy services for our students. This fall semester, we are extremely excited to continue offering telehealth services via our HIPAA-compliant Zoom platform. Therapy services are available Monday through Friday from 8 o'clock a.m. to 5 o'clock p.m. You can simply refer students to the Counseling Center by encouraging them to call 757-727-5617 to schedule an appointment. After they are scheduled for an appointment, they can simply go online and complete their intake paperwork, making the process as seamless as possible. In addition, we will continue to have therapists on call 24 hours a day, 7 days a week, if there are crises that occur after hours. In addition, I would like to share with you all some available online resources. The university has invested in Therapy Assistance Online, TAO for short. TAO is a series of self-paced modules that our students, faculty, and staff can access in the privacy of their own home. Topics range from how to manage finances to how to deal with depression to also various mindfulness exercises that your students and again, you as faculty are able to access. In addition, we do have some recommended applications for smartphones. You'll see these listed below, and please, again, we encourage you to include this in your syllabi for your students. We are extremely excited to continue servicing the wellness needs of our students this fall semester. Please do not hesitate to contact us if you have any questions. We are available to assist you as we all support the mental health needs of our students here at Hampton University. I wish you a wonderful fall semester as we all navigate COVID-19.
The university has procured the Back to Campus COVID-19 course by Collaborative Institutional Training Initiative Program. The program provides easily accessible online instruction on COVID-19 and is free to students, faculty, and staff until October 1st. All students, faculty, and staff are encouraged to complete the Back to Campus COVID-19 course. The complimentary course will train the campus community on COVID-19 safety and preparation for your return to campus. A resource guide will be emailed to faculty this week. We are one Hampton family. Each of us is responsible for keeping our family and our community safe and healthy. This is a challenging time for all of us. Therefore, we must work together to protect ourselves and each other. All questions may be forwarded to an email, deanofstudents@hamptonu.edu. Hampton hugs to each of you.